Welcome back. This morning, we're going to continue our conversation with Olympian clinical research and the importance of clinical research trials. And this morning, we're going to focus on depression. And joining me once again is Dr. Yokum, who has been in the business for quite some time and has seen how depression really can affect people, and it really just affects their lives. We're going to talk about wages and jobs and how it affects relationships. Again, doctor, I mean, we were talking before we got started. I think depression has been around for certainly many, many years, and it's not going away in 2020 because of our climate now.
Yeah, that's correct. Depression has been around for many, many years. It affects millions of Americans, even before the pandemic. Certainly, the rates of depression have increased since the start of this pandemic. And I think we anticipate that that will continue to happen. Rates of substance abuse have increased, and also post-traumatic stress. It's been a rough time for everyone, which is why I think it's good to talk about this topic.
And talk about the ripple effects, which I know is what you wanted to bring up too, where, again, you talk about millions of people, and it doesn't discriminate either, young,
Right.
old, no matter what your background is. And this really has some long-term effects, I think, in people's lives.
It does. So the symptoms of depression, the core symptoms are basically at least 2 weeks of, having a persistently sad mood, with or without loss of interest or loss of pleasure in the things you do. You see people with lower energy, low motivation, weight changes, appetite changes, and that can affect everything. If you don't have enough energy, you may not want to go to work. If you do go to work, you may not be able to focus. It can lead to job losses. It can lead to relationship problems. It can lead to a whole lot of things, which is why treating depression early and effectively is really important.
Well, and talk about treatment and what you're able to see in these clinical trials too, because just as there's a wide variety of depression and anxiety, there's also a lot of treatment and different things that people are trying.
Yeah, that's correct. So we've done a number of studies in the past, ranging from just treating new onset episodes of depression to treatment resistant depression. Typically, when someone becomes depressed, they'll usually reach out to either their primary care physician or their OBGYN or a psychiatrist. And often they're started on medications as the first move. Of treatment. There are other options available for treatment, psychotherapy, brain stimulation techniques, but medications are pretty standard as the first line. The problem then becomes if someone takes a medication and they don't feel better, or they want to feel better quickly and they don't understand that medications take a while to work. And so this ongoing discussion with their physician about what symptoms they have, what's gotten better, what symptoms still remain, that's really important when looking into how to get complete remission from the depression.
And there are currently trials. I know you have one at your office right now, but you said there are several that are open right now. What do you want people to know? We have about a minute left when it comes to clinical trials and depression.
Okay. Really, I just want you to know that there are options out there. A lot of trials right now are focusing on adjunctive treatment for medications that are only partially effective. We're running one of those at our clinic. There are other trials out there. You can always go to clinicaltrials.gov and look up research trials all over the country. But just to get the message out there that there's hope and you can get better.
Yeah. Well, doctor, we really appreciate your time this morning. It's always nice to catch up with you, see what you're working on. There's the website to find out more, certainly the phone number as well. But doctor, again, we appreciate your time. Thank you so much.
Thank you so much.